Time for another CBCLIPS. Well, we have a newborn male with no passage of meconium and abdominal distension. You do an anal exam, and the anal canal appears normal, but somewhat funnel-shaped, and it doesn't probe. No entry into the rectum. The patient undergoes a colostomy, and I will show you the distal colostogram. What malformation do you think this is? And what would be your surgical approach? What key radiologic study is vital here? Well, this seems to be a patient with a rectal atresia. The anus appears normal, somewhat funnel-shaped, and doesn't probe, and obviously the baby is distended. Colostomy was the right choice. An MRI to make sure there's no associated presacral mass is vital. And an MRI, both pelvis and spine, is necessary because, as you know, about 40% of presacral masses have a dural connection. Well, in this particular case, there was no presacral mass, so it's time to talk about the surgery. The distal colostogram shows a fairly high rectum, not ideally reachable through a posterior sagittal incision, which would have been my first thought. I think this case is amenable to a laparoscopic mobilization of the distal rectum and then a transanal approach, just like a Swenson you might do for Hirschsprung's disease. If the rectum were lower, I would have approached this posterior sagittally, found the distal rectum, mobilized it, and sutured it to the anal canal. The anal canal in these cases are quite normal and therefore must be preserved because they are key components of continence for this patient's future. Thanks so much.